talk about Babesia treatments, and I'm just trying to give it one piece at a time. I don't want to toss 1,000 pages at you, which is about what me and my research partner have published on Babesia. One is, does Zithromax help kill Babesia? So the standard treatment by some reasonable, smart people is the atovaquone yellow paint, 2 teaspoons, and we talked about that in a different talk. I just want to talk about the other half of the prescribed treatment, which is 250 milligrams of Zithromax or azithromycin, and that's what's in a Zpak, and maybe some of you have had that for a very rapid infection that didn't need longer treatment, like some of the things I've published on, which are very slow-growing infections. So we looked at the Babesia inside of red blood cells, and we saw zero movement with 500 milligrams a day. It's a very good drug, and I can see why it'd be recommended. But in my 2009 Babesia update, we published research that I think a number of people have missed that want to be experts in Babesia, and we showed that 1,500 milligrams of azithromycin, and yes, we got EKGs to check the QT interval, but there was no decrease in the Babesia inside the red blood cells in serial examinations, one after another. But what we did find is 2,000 milligrams of azithromycin did contribute to the death of Babesia. So I think some doctors, and there's really one particular one that's kind of the leader in typical Babesia treatment among people, that azithromycin is, as in, I don't know, 1,000 times the size of a bacteria. So we shouldn't assume that what might work for strep infection is going to kill a single-celled parasite. And here's what my research has found over decades. It's harder to kill Babesia than malaria, much harder. So it's not a surprise to me, after we did the research, that you need 2,000 milligrams of azithromycin if you're really going to say, I'm going to give enough azithromycin to really contribute to the killing. And my feeling is the small number of experts in the world are all saying one or two things is not curative of Babesia. Do they drop body load? Yeah, if they're at the right dose. So I think that's enough on that. And stay tuned. The next one will just be absolutely magnificent. I could be lying, could be telling you the truth. All right, gang, have a great week. Bye-bye.
I wrote the first Bartonella textbook in 2008, but this new one will be authoritative for many years.